Hey everyone, this is Mike from Express Counseling and Real Life Counseling, and this is going to be the beginning of a new series of session by session videos on different theories of counseling, and actually as if it was a treatment. So this is a session by session treatment program to show you what it would be like and to bring you along session by session so you can see some of what happens in a therapy session. Now today, I'm going to talk about interpersonal psychotherapy, IPT. It was developed in the 80s, and maybe even before that, and initially for depression. It was interpersonal therapy for depression, and then it expanded to other areas, including anxiety and eating disorders, and different populations within depression, for adolescent, for example, and adult. And it is also used individually. It's used in group. There's group interpersonal therapy sessions. So it has a flexibility. So the idea of interpersonal therapy is that it is a time-limited therapy. It's approximately 16 sessions, so about one a week, about 16 weeks. And the first two sessions, maybe three, is really getting some background. So I'm going to go over as if this was a session. And it's going to be more technical, it's going to be more dry, it's not going to get into the meaty stuff yet. But I want you to understand what you'd be getting into if you were in a therapy session with a professional who did IPT therapy. And of course, I'm doing this as if it was an individual session as opposed to group. So the first thing is that, as in most therapy sessions, you just get some background information. What is your name, your address? You ask about history, medical history, family history, physical history with previous counseling. You just get some background, phone numbers, emergency contacts. You also do a lethality assessment. You know, is a person feeling suicidal? Those kinds of issues, and you just get more of the technical. And if it's, you know, with therapy, you get the basic. You get insurance information or you know, payment schedules. So you get some of that information out of the way, and that's pretty standard for most therapies. Then with interpersonal therapy, you want to get a diagnosis. You want to get a diagnosis in order to figure out what kind of depression or what kind of issue, anxiety, whatever the problem is, and you usually use that for with the DSM, which is kind of like a therapist's Bible. And you know, I have a copy here of the DSM, and there's a number of categories. There's the disruptive mood dysregulation disorder, major depressive disorder. There is what used to be called dysthymia, which is persistent depressive disorder. There's bipolar. There's several, and then there's like subcategories within these. So the first thing is to find out what the depression is, or is it an eating disorder or anxiety. Now you're really getting this more to help the client. Now sometimes insurance requires it, so you've got to put it for insurance. But even if you're not taking insurance, you just want to find out what the person's diagnosis is, so you know what you're looking at. The second thing is that, and one of the ways that you can do that is you can ask them a series of questions, right? So you want to know how long have they been feeling this way. You want to know, you know, was there anything that triggered it? Does it occur at a particular time? What are some current problems? Are they having any challenges at work, with their family, with their friends? Do they have trouble sleeping, trouble eating? Do they sleep too little, too much? Do they eat too little? Do they eat too much? Is there any substance abuse problems? Are there any drug and alcohol problems? They'll ask you, you know, how long have you been feeling down? Is it severe? Are you depressed more days than not? Does it last all day or part of the day? Is it more prevalent at night or in the morning? Have you lost interest in things that normally interested you? A whole bunch of stuff, and that takes up a big part of the first session. So just getting a little bit of the technical background, who you are, your address, your name, those kinds of things, and then finding out what your diagnosis is, what's the depression, by asking you a variety of questions. And then, and depending on the session, that could be it. Sometimes you'll add in the first one explaining what depression is and letting people know it is one of the most common disorders that people have. It's also one of the easiest treated. You'll explain to them how long the treatment is going to be, that it is a time-limited therapy, that that it is going to be usually weekly, but that could change. You're also going to explain that depression can run in families. It is more prevalent among women than men, although it is increasing across the board, and it's even increasing among adolescents. That it's fairly common. That it's not doesn't mean you're crazy. This is a pretty common, and you'll have the whole idea of what depression is, how it manifests. Do you need medication? Most therapists are not doctors unless you're a psychiatrist, but you can talk about medication. If you're on medication, if you're already, should you see your doctor to get medication? Medication will not have a problem. You can be on medication and still go in the program. But you're basically kind of normalizing and educating the client and letting them know what the treatment protocol is, how long. IPT is also in the here and now. They don't go over your past endlessly. It's not, they're not talking about what happened when you were a child. They're focusing on the here and now, in the present. And the therapist is probably a little bit more active, a little bit more directive in their treatment, as opposed to being more passive and just sitting back and listening and responding. And this is basically what will go on during the first session. And so you have an idea. So this would be session 1. As you can see, the video is already over 7.5 minutes, and the real session could be, depending on the therapy, 45 or 50 minutes usually. So this is abbreviated, but obviously taking the time to ask the questions and have the questions answered would take a much longer time. So this is session 1 of interpersonal psychotherapy, mostly for depression, but showing some promise for anxiety and even eating disorders, and with different populations, adults and adolescents. And we will go on to session 2 in the next video. Hope you are all staying safe, and I look forward to seeing you the next time. Thanks so much.